Hello everyone. I just finished the teaching level 1 and 2 course ANF in Dubai. It's been a long day working at the clinic and teaching until this time of the day. It's a bit busy day, but I'm so happy, and as we finish here with our Meekins time, that it's always thinking, and my brain it's really burning of thinking. I decided to do some practice of my breathing, and I'm gonna invite you all to be here with me. If you cannot watch it now, I'm sure you're gonna watch it later. How to breathe properly. I know there is many different techniques that people talk about breathing. Yogis, they do a way more into the abdominal, but the majority of us, we will see, I can see wave now, hello. I see a lot of people using what we call the accessory muscles. So we end up breathing in a short breath using all these muscles here. So a really good quick technique, which I use it a lot, and I explain to the patients what happens is if our ribs are attached to our sternum but also attached to our spine, and if we don't move the ribs as we're supposed to, I always compare a bucket movement, the handle of a bucket that they breathe in and out. What happened is our thoracic spine started to be without much movement, and we end up seeing a lot of patients with having hypermobility and neck pain in the neck and into the lower back, because this area is blocked and is congested, and it normally starts from breathing. It's one of the first exercises I always teach patients. I'm going to practice a little bit now because I need it after a long day, and I hope you can practice with me. So, are you ready? You don't need much. You just need your hands in this position where you're going to literally have your thumb touching your rib cages at the back. So if you can see here, and in the front touching your ribs, your lower ribs. So if you're a woman, underneath your bra, if you're a man, trying to find your lower ribs a little bit above your hip. And we're gonna have to feel the fingers being pushed away by your breathing. So when you inhale, you have to feel that like a 3D dimension thing. You have to push into the front, into these fingers, but also into your thumb. So you're gonna have to feel this movement happening into the ribs. Okay, are you ready? So make sure you look at your accessory muscles, that you're not doing any of this, and you're gonna concentrate into your hands, and you're gonna try to push your hands away. So ready, let's go. Inhale and exhale. Inhale, feel the movements, feel the air inflating your lungs and pushing your hands away in a 3D dimension. So we don't want to see this. We don't want to see the shoulders, and we don't want to see the belly going in. That's not this. It's all about here. Diaphragm. We want to expand everything. So I hope you can see well. And exhale. Inhale. And exhale. Good. Another good technique that I like to do, we're gonna try to inhale in 7 times. We're gonna hold 1 and we're gonna let it out in 4. So inhale 7, 1, 2, 3, 4, 5, 6, 7, hold, and exhale 1, 2, 3, 4, hold, inhale 1, 2, 3, 4, 5, 6, 7, hold, let it out 1, 2, 3, 4, hold, Last time. 7, 1, 2, 3, 4, 5, 6, 7. Hold and let it out for 4. 1, 2, 3, 4. That is the second technique I really like to do, making sure you can inflate as much as you can. And there is another one that I like to do, especially when I'm tensed and stressed through the day. It's a very quick breath, and you're gonna inhale in and out as quick as you can. And I want you to feel that your diaphragm is literally doing what it's supposed to go, up and down. So at this time you can place your hands in here in the front where you really kind of connect, and you're gonna do, and this time you will feel a little bit of contractions into your abdomen, but I also want you to feel this up and down of your diaphragm. So you ready? Short but fast breathe in and out. Good. I hope you understood that. We have in osteopathy that we call the 4 diaphragms, and it's so important that all your diaphragms work together. First diaphragm we call the basilar area, where we have our brain kind of lying onto it, and this diaphragm is connected to our diaphragm, the real diaphragm, and we have the pelvic floor that we also call a diaphragm, and the pelvic floor tends to really follow our diaphragm. So if your diaphragm is tight, if you're not breathing properly, you're probably gonna have a tight or a lot of pressure into your pelvic floor. And the arch of your foot, yes, the arch of your foot is also another diaphragm, and if that collapses, your diaphragm will probably also collapse and will create a lot of issues with your deep front line of the fascia and all the connections into your organs. So when this doesn't move much and your diaphragm doesn't expand, we also create a lack of oxygenations and movement around our gut. So very important to practice your breathing whenever you're starting to get anxious, whenever you start getting stressed, or at the end of the day, like now after a long day. I'm really gonna finish that with my breathing. So breathing is life, breathing is essential. Make sure you practice your breathing, and I hope I helped you with this quick video. Have a good night or day, I don't know, wherever you are in the world. Bye now. Thanks for watching.